Hello viewers, let us now discuss about the various complications of diabetes. Before we go into the complications of diabetes, it is pertinent to discuss as to why diabetes should be treated in the first instance. The intention of controlling blood glucose in a person with diabetes is to prevent the various symptoms of high blood sugar, such as excessive thirst, passing too much urine, and feeling exhausted, to mention a few. Apart from this, the purpose of controlling blood glucose in a person with diabetes is to in fact prevent the various complications that a person with diabetes could develop if high blood glucose levels are not controlled in a proper manner. If we try to dissect the various complications of diabetes, we can differentiate them into two types: macrovascular complications and microvascular complications. Amongst the macrovascular complications, we do have complications such as heart attack, which is related to the heart. We do have complications such as brain stroke, which is again due to decreased blood supply to the brain, and of course peripheral vascular disease, which means decreased blood supply to the feet, which results in gangrene and such complications. Apart from this, we do have microvascular complications. That means the small blood vessels could be affected because of the high blood sugar levels, and this can lead to various complications such as that of the eye, such as that of the kidney, such as that of the nerves. Firstly, if we look at the various complications of the eye, most of us are very well versed with the word cataract. That means the lens of the eye can get affected because of high blood glucose levels and can be in not a good order in order to facilitate proper vision. Apart from this, people with diabetes with poor glucose control can develop complications of the retina, that means the screen behind the eye, which is called retinopathy, which can lead to blindness if not recognized at an early stage and treated appropriately. This apart, we do have complications pertaining to the nerves, such as burning sensation of the feet, the sensation as if a person is walking on pebbles, and people can't differentiate between temperature. That means extreme heat can't be differentiated when a person is walking on hot or warmed up soil, and also complications pertaining to kidney, such as your nephropathy, which can result in permanent damage to the kidney and thus to detrimental complications such as death even. So, the reason to control blood glucose levels in a person with diabetes is to prevent all these deleterious complications. These apart, we do have complications such as erectile dysfunction. That means a man cannot get a proper erection or may not be able to sustain an erection and can have potency problems if the blood glucose levels are not well controlled in a diabetic individual. So, ladies and gentlemen, it is very important to prevent all these complications by controlling blood glucose levels, controlling blood pressure, which is possibly excess in a person with diabetes, and also controlling the excess cholesterol levels in a diabetic person. If all these three parameters are well controlled, i.e. blood sugar levels, high blood pressure and high cholesterol, then most of these complications could be averted. These apart, we do have other complications such as your fatty liver. That means the liver architecture is lost and there is excess fat deposition in people who are obese and have diabetes, and such complications can also be prevented by following a healthy lifestyle, preventing and treating obesity. So ladies and gentlemen, so far we have explained the importance of controlling high blood glucose levels in a person with diabetes in order to prevent the various complications. This all well said and done, we also need to know the importance of detecting these complications or screening for these complications at an early stage in people with diabetes, because unless we do periodic and regular screening for these complications, we may not be able to detect these complications at an early stage. And if these complications are left to their own accord without being detected at an early stage, obviously the complications would become severe and severe and may not be amenable to medical treatment or surgical treatment, as may be the case. Hence the reason every person with diabetes ought to get their eyes checked every year to check for any retinopathy, should get their feet checked periodically to prevent any cracks and to see if the sensation is fine and if the blood vessels are fine, and also to have simple kidney tests such as blood creatinine and a urine test called spot urine microalbumin, and also other tests pertaining to their cholesterol, pertaining to their 3-month glucose control called HbA1c, so on and so forth. Unless these are done periodically, it is simply not possible to detect the various complications of diabetes. Another important point is that people with diabetes are at high risk of developing heart attacks. So, an ECG or sometimes even a treadmill test, as may be appropriate, could be done to detect early stage heart disease or what we call as coronary heart disease before it becomes too severe. So, ladies and gentlemen, after all this discussion, I hope that it is clear to you that it is very important to A, prevent the various complications of diabetes, and B, to screen for the various complications of diabetes in a timely manner if you, your family members, relatives or colleagues have diabetes. Otherwise, this can lead to serious complications, unfortunately. So please take necessary precautions if you do have diabetes and stay well. In people with type 1 diabetes, i.e. people who have diabetes that warrants compulsory usage of insulin injections, if the individual neglects himself or herself by not taking the prescribed insulin doses or skips insulin completely or develops any serious infection and does not seek medical attention, then this particular individual might be prone to what we call as diabetic ketoacidosis, which is a state wherein the blood acid content increases and the person might end up in coma and sometimes even in death. Hence the reason people with type 1 diabetes mellitus should never stop their insulin and should always seek medical attention if they were to become unwell with any problem such as vomiting due to any simple gastroenteritis or due to any other reason when they are unable to take their insulin as usual. Also, in people with type 2 diabetes mellitus, that means people who are not necessarily insulin dependent, there is a serious complication that can occur, especially in the elderly, if again they neglect themselves without taking the prescribed medications and become dehydrated. They can develop a complication called HONK, H-O-N-K, or otherwise called HHS, which is a state wherein they become extremely dehydrated, the blood glucose levels are very high and can end up in coma and sometimes even death. Hence, the reason why we advise that people who are elderly do not neglect themselves, take care of their prescribed medications regularly, and also ensure that in summer months that they don't don't get dehydrated. So with these simple precautions, people with type 2 diabetes mellitus who are elderly can ensure that they don't end up in this otherwise deleterious complication called HONC or HHS. Thank you. So ladies and gentlemen, for tips about good health and about various complications and prevention of various health problems, please stay tuned to Health Masters. Thank you.